Dear students, we are going to discuss administration of two important organizations in the field of social work. One is National Institute of Public Cooperation in Child Development (NIPSET) and another one is Central Social Welfare Board, that is CSWB. First we will discuss the NIPSET. What is its establishment, vision, mission, objectives, function, major areas of operation, organizational structure, program and activities. So, in the NIPSET, the historical background of the establishment of National Institute of Public Cooperation and Child Development is because it is a premier institute devoted to the promotion of voluntary action, research, training and documentation regarding women and child development. This institute was established in 1966 under the Societies Registration Act 1860 as an autonomous institute. It has its headquarters in New Delhi and functions under the aegis of Ministry of Women and Child Development, Government of India. It has 4 regional centers at Guwahati, Bangalore, Lucknow and Indore. The objective of these regional centers is to cater to regions' specific requirements. Now, this is a apex institution and a nodal agency because the institute acts as an apex institution for training integrated child development scheme functionaries, that is ICDS functionaries. The institute has been designated as a nodal agency organization for training and capacity building of functionaries at national and regional level under the new scheme of integrated child protection scheme, as well as for imparting training on 2 important issues of child rights and prevention of trafficking of women and children for SAARC countries. The vision of the institute is to become a center of excellence in the field of women and child development in the southeast region by engaging in partnership with national and international agencies and making its training and research activities which are relevant to the needs of the clients. Mission of institute is to act as a think tank, catalyst and inventor of child rights, child protection and child development programs by pursuing capacity building of child development functionaries, research and evaluation, networking, consultancy and advisory services, as well as provision of specialized services through interdisciplinary teams. The objectives of the institute are develop and promote voluntary action in social development, promote and develop a relevant need-based program in pursuance of the national policy for children, evolve measures for coordination between government and voluntary action in social development, develop framework and perspective for organizing children's programs through government and voluntary effort, establishing liaison with international and regional agencies, research institutions, universities and technical bodies engage in activities similar to those of institute, and develop and promote voluntary action in social development through training and capacity building of the government and non-government functionaries, taking a comprehensive view of child development through research and development tools designed for supporting implementation of government schemes and programs, and coordinate meeting of Ministry of Women and Child Development with the stakeholders under different schemes, programs and policies for furthering the objectives and provide feedback. Now, we are discussing the functions of National Institute of Public Cooperation in Child Development, that is NIPSET. which it is an institute which acts as apex institution for the training of functionaries of integrated child development services and functionaries of integrated child protection scheme. Building the training capabilities of institutions engaged in the training of ICDS, ICPS functionaries and trainings. Provide training to the functionaries engaged in implementation of Rajiv Gandhi scheme for empowerment of adolescent girls, that is Sabla. Impart training to the functionaries engaged in implementation of conditional maternity benefit scheme, Indira Gandhi Maitri Sahyog Yojana. Prepare and procure training material for ICDS, ICPS. Monitor and supervise ICDS program. Functions as a technical support arm of the government in matters pertaining to the development welfare of both mother and children. Completes national policies and programs for women's development through training, research and documentation in the policy and micro level. Conducts research and training program sponsored by various central ministries and state government. Provides demonstration services for capacity building of trainees through child care center, child guidance clinic and adolescent guidance services center. Advocates and brings capacity buildings of the officers of the central and state government departments on gender issues. Develops awareness or generates awareness, sensitization and training to NGOs for prevention of trafficking of women and children. Finds gap in the legislative framework through evaluating different schemes of the various departments of central and state government. Provides support of Childline India Foundation lot organizing training program. Coordinates meeting of Ministry of Women and Child Development with the stakeholders and providing feedback. And now we will discuss areas of interest of the institutes. These have been early childhood care and development, health and nutrition of the young child and mothers, infant and young child feeding, prevention of micronutrition, malnutrition, adolescent health, reproductive health and HIV, AIDS, growth monitoring and nutrition and health education, child guidance and counseling, early detection and prevention of childhood disabilities, learning and behavioral problems of children and parent education, child rights and child protection, juvenile justice, women's empowerment and gender mainstreaming, holistic development of adolescent girls and family life education, prevention of child marriage, female fostericide and female infanticide, counseling and support services for women in distress, formation and management of self-help groups, prevention of trafficking of women and children, prevention of gender-based violence. So, gender budgeting, gender sensitization of law enforcement agencies, partnership initiative of governmental social organization in the area of child development, manpower development in social development sector, capacity building of civil society organization. So, these are the functions or concerns of the institute. Now, we will discuss the constitutional bodies, committees of the institutes, which has two constitutional bodies, that is general body constituted by representation of government and voluntary organization. It is responsible for formulating overall policies of this institute. The next constitutional body is Executive Council. It is also constituted by the representative of government and voluntary organization. The council is responsible for management and administration of the institute. The Minister of State for Women and Child Development is the president of the general body and chairperson of the Executive Council. Now, these constitutional bodies have different committees, and the working structure has been that the director of institute is an administrative head. There are two departments, namely Department of Mother Care and Child Development and Department of Training. The organizational structure starts from the president, then vice president, then other functionaries of the institute, which goes up to the joint director of the institute, which is visible through organizational structure on the screen. Each department is headed by an additional director, and there are 6 divisions working under these 2 departments. Department of Mother Care and Development has Public Cooperation Division. This division undertakes the activities of promotion of voluntary action, organization of communities, management of community resources, rehabilitation of children victim of difficult situation, capacity building of voluntary organization, and constitution of projects for that. Then there is a proposal to constitute Child Protection Division under Integrated Child Protection Scheme. Presently, the work of child protection is seen by this department. Child Development Division. This division acts as policy associate related to mother and child development issues. The main subjects of this division are mother and child health, early child care, education, taking of nutrients, and there is another division known as Common Services Division. This division performs the activities related to the administrative, financial and internal maintenance, as well as provides support services to headquarters and other divisions of regional centers. Then there is a department of the training. It has a training division. This division is related to the activities of planning for training of functionaries of Integrated Child Development Scheme, coordination of the training program, monitoring and operation of the training program, capacity building and preparation of infrastructure for institutions involved in the training of Integrated Child Development Scheme functionaries. Then there is Department of Training, which involves itself in the capacity building and preparation of infrastructure for institutions involved in the training of ICDS functionaries, preparation and modifications in training modules, preparation of training material, procurement of the training material. Then there is a Monitoring and Evaluation Division. This division provides technical inputs for monitoring social units related to ICDS and other programs. This division also monitors and supervises ICDS project through its central monitoring unit. Then Women's and Development Division. This division organizes different activities for the fulfillment of women development and empowerment policies and programs in a big way through training, research, documentation, clearing house and management services. Then there is this division devotes and implements programs related to danger issues, violence against women, immoral trafficking of women and children, sexual harassment of women at workplace, women empowerment, and so on. Each division is headed by a joint director. The regional centers fulfill the training, research and consultancy needs of the institute. Each regional center is headed by a regional director. Mother and Child Documentation Center. The institute has this center, which contains a rich collected literature regarding women and children. This center presents a review of research studies and books related to women and children. It publishes literature and propaganda material for the publicity of issues related to women and children. It has also developed a computer database containing published and unpublished material and data. Programs and activities. Now, we will discuss the program and activities of this institute. This institute conducts training and research as core activities along with field demonstration services and varied kinds of publication at its quarter and regional center. The programs have been training programs, regular training program. Under this institute organizes programs of orientation training courses for representatives of voluntary organization and officials of the government, workshops, seminars for categories of persons mentioned above, programs of subjects of topical interest, strengthens services delivery system. There is a training under ICDS, there is a system of training under the ICDS program. The institute is an affix institution for training of functionaries of ICDS program, which involves job training courses, refresal courses for CDPOs, ACDPOs and trainers, workshop, consultation meets, training under ICDS, orientation, refresher and skill training of trainers, conducting research, evaluation, documentation and compilations. A strengthening of monitoring and supervision system in ICDS program through central monitoring unit. The monitoring setup has 3-tier setup, that is monitoring at community, state and national level, then organization of demonstration services, maintaining database, conducting full-time advanced diploma in child guidance and counseling. Till now we have discussed about the NIFSET organization, which is basically a training organization for ICDS functionaries. Later on, Indian Child Protection Scheme functionaries also included for the training purpose in the NIFSET program of training. So, basically this is the training program for the agencies, officials engaged in women and child development field. Now, we will take up the administration of another premier organization, that is the Central Social Welfare Board. Historically, the board was set up on August 12, 1953 by the resolution of the Government of India, and it functions as an autonomous body under the administrative setup of the government. To foster healthy growth of social service organization through well planned and directed financial aid was the major objectives. The functions of board have been to cause a survey to be made of the needs and requirements of social welfare organization, to evaluate the programs and projects of the aided agencies, to coordinate the assistance extended to social welfare activities by various ministries in central and state government, to promote the setting of the social welfare organization on voluntary basis in places where no such organization exists, to render financial aid when necessary to deserving organizations or institutions on terms to be prescribed by the board. Now, these are the functions of the Central Social Welfare Board. Initially, board has formed certain panels and expert committees. So, these committees work as for the survey of the needs and requirements of the existing social welfare organization, and for this panel on child welfare, panel on women welfare, panel on welfare of juvenile delinquents and physically handicapped were formed, and followed by the committees which have been the Committee on Aftercare Services and Social and Moral Hygiene, Committee on Aftercare Services for the Handicapped, and Committees on Social and Moral Hygiene. These were formed to chalk out the programs of the Central Social Welfare initially. Now, We will discuss the status, functions of the State Social Welfare Advisory Boards. These boards, now known as state boards, were constituted in 1954. With the result, 26 state boards came into existence. Presently, these are 33. These boards have been in operation as counterpart to Central Social Welfare Board. These boards are acting as a liaison bodies between CSWB, state government and voluntary welfare institutions. And these boards also receive, scrutinize and examine the applications received for grants in aid before inspecting and recommending these institutions to CSW for grant. Then what is the organizational structure of CSWB? The main feature of this structures have been that board is headed by a chairperson. It has general body consisting of 58 members. It has executive committee which also consists of 16 members. Now, we will discuss the composition of general body of Central Social Welfare Board, which consists of chairperson CSWB, all chairpersons of the state social welfare boards, representatives for the parliament, 2 from Lok Sabha and 1 from Rajya Sabha, 5 professionals, 1 each from law, medicine, social work, education and social development, nutrition, 3 eminent persons with extensive experience of social work. This general body consists of the representative from different ministries and department, and the rank of joint secretary become the member of this particular general body. And the ministries are Ministry of Women and Child Development, Ministry of Rural Development, Ministry of Health and Family Welfare, Ministry of HRD, Department of Secondary and Higher Education and Ministry of Social Justice and Empowerment. Then Ministry of Labour and Employment, Ministry of Finance, Department of Expenditure, Planning Commission, Financial Advisor, Ministry of Women and Child Development. Then Executive Director, Central Social Welfare Board. So, these are the members. We will discuss the composition of Executive Committee, which consists of Chairman CSWB, Chairperson of State Union Territories of the states of Maharashtra, Karnataka, Assam, Rajasthan, Andaman and Nicobar Island. Then representatives of the ministries, Department of Government of India, level of Joint Secretary of Ministry of Rural Development, Ministry of Finance, Ministry of HRD, Director of Secondary and Higher Education, Ministry of Social Justice and Empowerment, Financial Advisor, Ministry of Women and Child Development. Then there is 2 professionals and Executive Director of CSWB. The organizational structure starts from the top. From the top it is from the general body, then executive committee, then chairperson, then executive director, then joint directors 4 in number, then deputy directors 12 in number, then 2 editors, an SRO and 1 IFA CAO, then assistant director 26 in number, 1 RG, 1 P and IAG departments and 1 accounts officer. These are this kind. Now, the mission of CSW is, as a national organization, strive to be recognized as the most progressive entity for providing services of unequivocal excellence to women and children for their protection, capacity building and total empowerment, to raise awareness about the legal and human rights of women and girl child, and to run campaigns against social evils affect them. Now, I will discuss vision statement of Central Social Welfare Board. According to the vision statement, the board must act as change maker with a humanitarian approach, reinforcing the spirit of voluntarism, create an enabling mechanism to facilitate networking of committed social workers for the empowerment of women and children, develop a cadre of sensitive professionals with a gender-centric vision committee to equity, justice and social change, and recommend gender-specific policies initiative to meet the new challenges of women and children in emerging areas, strengthen voluntary organization and expand coverage of endangered scheme in areas where they have not yet reached, initiative and strengthen its monitoring role to act as social audit and guide for voluntary sector so as to access government funds as resource, generate awareness about the challenges of society in transition where negative use of technology and practices are impacting on the well-being of women and children. Now, we will discuss programs of Central Social Welfare Board. Since inception, the board has launched several programs for women, children, families and upliftment of weaker sections socially and economically. However, it is to be known to the students that some programs which have been started earlier by the Central Social Welfare now discontinued. These are General Grant in Aid Program, Welfare Extension Projects, Family and Welfare Projects, Border Area Projects, Balwadis Demonstration Projects, Mahila Mandal Program, Working Women Hostels, Socio-Economic Program and Holiday Camp for Children. These programs were earlier started initially, but now they have been discontinued by Central Social Welfare Boards. Now, the programs of during the period of 11th plan, which are continuing in this plan also, these are awareness generation camp for rural and poor women. This program was introduced in the 1986-87. The main aim of the program was disseminating information amongst women and community and their rights, status and problems of women and other concerns. The objectives of this program have been to identify the needs of the rural and poor women, to increase actual participation of women in development and other allied program, to train organizers of this camping activities. Another program is a condensed course of education for women, which was started in 1958 with the aim to provide educational opportunity to girls, women above the age of 15 years along with additional inputs of skill development and vocational training. The courses are organized through voluntary organization engaged in the field of women welfare and education, which are identified and recommended by state boards. Here, more than 60% courses have been sanctioned for middle and high school level and about 40% for primary levels as per need of the area. Then another program is Rajiv Gandhi National Crèche Scheme. This scheme of Ministry of Women and Child Development, under which assistance is made available to NGOs for running creches for children of 0 to 6 years. This provides sleeping facilities, health care, supplementary nutrition, immunization for running a crèche for 25 inmates for 8 hours, that is from 9 a.m. to 5 p.m. Then Family Council program, which was earlier initiated in March 1983, and this is described as flagship program. The objective have been to provide preventive counseling and rehabilitation services to women in distress due to the atrocities, family maladjustment and social ostracism and so on, to provide crisis intervention as well as counseling services for victims, to provide trauma counseling services to women and children in case of disaster or crisis. These centers work in close collaboration with local administration, police, courts, legal aid cell and so on. They also create awareness and mobilize public opinion on issues affecting status of women. Another program has been of the short stay homes, which was launched in 1969 with the objective of for the rehabilitation of women and girls who are facing social, economic and emotional distress due to family problems, social ostracism, exploitation, violence, being forced into prostitution or in a moral danger These homes provide temporary accommodation, maintenance and rehabilitative services to women and girls rendered homeless due to the family discord or crime. Temporary shelter is made available through voluntary organization to those women and girls with facilities of casework, counseling service, medical care, psychiatric treatment, skill development, training, education, vocational and rehabilitation services. The scheme has an inbuilt component of 10% increase for rent every year and 15% under maintenance of inmates every 3 years. Now, another program is an integrated scheme for women's empowerment for northeastern region. This scheme has been developed to address the socio-economic needs of the women and children of selected at most backward districts in that particular region. Now, this scheme is being implemented on pilot basis from 2008 and has the objectives of meeting the felt needs of the area by mobilizing community action, converging available services and resources of the area, income generation through feasible and sustainable activities for women, and providing service for health awareness, career counseling, vocational training, preventing child trafficking and other social evils. Now, another is disaster relief program, which has been envisaged to provide relief during disaster period through voluntary organization. Then there is a program, another program, that is the award program in the name of Dr. Durgabai Deshmukh, which is for the women development. This award has been implemented and an amount of Rs 5 lakhs is awarded every year for recognized work in the field of women development. The publications of the CSW are Social Welfare Magazine in English and Samaj Kalyan in Hindi. Certain innovative schemes has also been launched, that is it has a provision to introduce innovative schemes in the area of women and child development implemented through voluntary organization recommended by state board. My dear students, the overall conclusion of this lesson has been that you have learned about the two premium program or two premium institutions working in the field of social welfare. These are NIPSET and CSWB. NIPSET is basically concerned with the training of the functionaries of the ICDS and Indian Child Protection Scheme, whereas this particularly CSWB is concerned with the promotion of the voluntary agencies working in the field of social welfare, particularly in the area of women and child development.